taking a bit of time. Okay. That's all right. We'll let some more people filter in. Hope everyone's well and getting ready for the holidays. All right. One moment. Apologize for the delay. We might have to not go live on YouTube. Oh, no, there it goes. Took a little bit of time, but looks like we are now live on YouTube. Okay, so welcome to episode 86. And tonight, I initially entitled this Choose Your Own Health Destiny, but really what it is it's sort of a starter class in terms of understanding what the future of medicine is, as well as understanding what's available now to be able to allow you to determine what makes you unique. And I think you'll see that there is going to be a very big change when it comes to modern medicine as things progress over the next several years. And you'll see some of these things are already happening. So let me share my screen and we will get started. Okay. So I changed the title to What Makes You Unique? And we'll talk a little bit about the current model. Then we'll go into factors of difference, and then what current offerings there are to help you understand your biochemical individuality. I just want to make one change here. Okay, good. All right, so let's talk a little bit about what the current model, the current medical model is. And we all know that there are a lot of problems, but ultimately, we've gone through several phases when it comes to modern medicine. The most dramatic changes we've seen over the last, 150 years really was, it goes back to many different things. If you look back at classical medicine, our modern medical system really is based on sort of the Greek model, that goes back many, many thousands of years, of course. And over that time, of course, there have been things that have changed over that period of time. There's been a change from, as an example, from the introduction of antibiotics was this huge revolution, and it was also sort of the identification of pathogens as causes of disease. And when antibiotics were created, that sort of framed the model in a way of, okay, well, we have this organism, it causes this particular disease, and this is the medication that takes care of it. And unfortunately, that notion of honing in on one particular diagnosis and then following up with a pharmaceutical treatment, there's lots of articles that have been written about sort of how that sort of evolved, but we can understand how it happened in the sense of understanding it from an infection model where a microorganism was associated with a diagnosis, with a disease, which was then treated with an antibiotic. Unfortunately, the problems we have nowadays when we're dealing with chronic diseases and such isn't that we are, apologies, I just lost my track of thought with that message that I just got. So ultimately, we realize with the current model, the current challenges that we have in terms of chronic disease, it's not going to necessarily work that way. And I think you'll understand that in just a bit. The reason it can't handle the burden of chronic disease is because, unfortunately, there's not going to be one single medicine that's going to solve these particular problems. I mean, if people are having high cholesterol, high blood pressure, all these sorts of things, we realize that treating one thing with one medication and then another thing with another medication, unfortunately, is not getting to the root causes of the problem and not really addressing them properly. So it's not addressing these sorts of things. And ultimately, because we've sort of framed modern medicine when it comes to thinking about it as a single therapy, a silver bullet therapy, unfortunately, until we sort of overcome that thinking, that there's going to be one medication that's going to solve the problem, we're not going to be able to address the burden of chronic disease as well as addressing these underlying factors. Additionally, this notion that randomized controlled trials are the gold standard. Well, they are when you're assessing a single individual therapy, but they're not when you're talking to try and figure out what happens with each individual. And we'll talk about the genetic differences that people have. Lifestyle interventions, it'd be very, very difficult for you to do a randomized control trial because, of course, people, if they're going to be exercising and changing their diet, all these sort of factors are difficult to control in a setting. And therefore, it's very difficult to use a randomized control trial. Additionally, in terms of modern medicine, there's a lack of publication of negative trials. So if the medication doesn't work, that's valuable information. Unfortunately, that doesn't necessarily get published. There has been some change in the past 20 years, where there has been sort of more of a push to make sure that this info is being made more available. But ultimately, the lack of publication of negative trials is one of the problems of the current model. Direct-to-consumer marketing is also sort of swayed the way people envision and view and have opinions on modern pharmaceuticals. We all see on TV the commercials for medications, and we're given the impression that these medications are going to solve our problem. And unfortunately, that's not necessarily going to be the case, for one, but additionally, it sort of sways and influences the prescription of these medications, which ultimately has potentially negative problems. Most countries around the world, by the way, do not allow direct-to-consumer marketing of pharmaceuticals on TV like we have here. I think it's just here in Australia that allow that. And I think it's, as much as I am completely in favor of people having open access to information, I don't consider commercials being the same thing as having open access to information. And therefore, it's probably a negative thing to see all these commercials on TV. Additionally, there are financial conflicts of interest in the current medical model. And honestly, when it comes to medical education, they even influence the curriculum, some of the curriculum of medical education in medical schools as well. So these are the problems that we have. And I'm not criticizing the current model by highlighting these problems. I still practice conventional medicine and still use all the latest medications. Of course, I also offer lifestyle interventions and would love it if people took me up on that. But the fact is that most people don't want to make changes in their lifestyle. And therefore, my job is to treat them. And therefore, I don't have any problem treating people with pharmaceutical medications. They have come to expect it. And unfortunately, doctors are not trained in treating people through lifestyle interventions, and the system is not built that way. It's a hobby of mine and a passion of mine to be able to help people to do that. But ultimately, in the current model, it's very difficult to do so. And as I said, patients are expecting pharmaceuticals and silver bullet medications, because that's what we have almost swallowed whole in terms of thinking about what modern medical treatment is. It is going in, getting a diagnosis, and therefore getting a certain medication. But we have to realize that ultimately that means that we are also seeing the diagnosis as this really clear-cut entity. And we're also looking at medications as saying, well, the majority of people will have a certain response to a certain medication. Therefore, we're dealing with sort of a law of averages in the sense, well, most of the people are going to respond to this particular medication. Unfortunately, that completely neglects all the remarkable individual factors that we're going to be discussing for the rest of tonight's class. But we should first understand that when you think of a diagnosis is really not this clear-cut entity that is unchanging. And if we're tied to the fact that a diagnosis is this sort of certainly clear-cut, entity, then it's not going to allow us to address all the individual factors that are going to make one person not respond to a medicine, one person respond more to a medicine, one person get sick from a medication, one person respond to a lifestyle intervention versus another person not. As an example, there's certain what are called comorbidities and things, chronic diseases like, say, psoriasis, in alcohol intake, obesity, these sorts of things. But not everyone who's obese has psoriasis. And so there are all these individual comorbidities, other factors that can play in a sometimes more than oversized role in this condition, which means that the condition itself is not a clear-cut entity, that there are so many other factors involved. And by having a clear understanding of all these individual factors, it gives us just a better appreciation of ourselves as individuals. And it also gives us a sense of pushing some of the authority over to ourselves. In other words, having the confidence to realize that there may be a certain uniqueness. There is a certain uniqueness about you and your body that can be determined to help you with your overall health. So let's go into what those sort of, looking at it from a scientific perspective, what makes you unique? What are the factors of difference? Let me close a few of these down. And we'll first talk about nutrients. And ultimately, before, when we spoke about many, many years ago, historically, nutrients were looked at as preventing a certain disease, whether that's, rickets or other sorts of things. And therefore, by prescribing a certain dose of, say, vitamin D to get rid of that particular deficiency disease, that was set as the dose that is recommended. Now, speaking about vitamin D, we spent a whole episode, I think around 3 weeks ago, talking about just how many different uses the body needs for vitamin D, from immune function to bone health, to a whole host of things. We spoke about the immune system specifically several weeks ago. And ultimately, what we're understanding now, especially with the COVID epidemic, is that the deficiency dose, just to prevent a certain deficiency disease, is not what we need for optimal health. And unfortunately, this goes with all of the, quote, recommended daily doses of nutrients. Ultimately speaking, it means that there are certain conditions, situations that are going to give us the requirement that we need to take more of these medications. So, it used to be that old-fashioned doctors were able to look at the whole body and come up with certain things. And in fact, there were also diseases that would manifest in many, many different ways. As an example, syphilis. Syphilis was, I forget what we used to call it in medical school, the great mimicker or something like that, because syphilis could show up in so many different ways. It could present in so many different ways. And therefore, it gives us an appreciation for the total body phenomenon that is disease. And we're coming to a recognition of that with a whole host of conditions. Like, for example, gluten sensitivity. People can have celiac disease, but also can develop a whole host of other particular problems, things that lead to hair loss and increase susceptibility to other autoimmune diseases. And therefore, it used to be that old-fashioned doctors were able to sort of look at things from a global perspective and try to put things together. I'm not saying that doctors don't do that anymore, but it's not as common as it used to be. Specialists, unfortunately, when there's a disease that is in the realm, is looking at it from a very narrow perspective. And and they're going to be prescribing. I'm seeing a notice that my internet connection is unstable, so hopefully you're able to hear me. When you get referred to this specialist and that specialist, unfortunately, sometimes they're not talking to each other in different organ systems. So the future will be, of course, that ultimately we'll come back to this notion that one condition can be expressed in many, many different ways, and look at the organism as a whole. Now, there was a doctor by the name of, I think I'm pretty sure he's still alive. He's definitely in his 90s. He's a PhD. His name's Bruce Ames. And he said that our analysis of metabolic disease, and I'll sort of translate this because it sounds very scientific. Our analysis of metabolic disease that affects cofactor binding, particularly as a result of polymorphic mutations, may present a novel rationale for high-dose vitamin therapy, perhaps hundreds of times the normal dietary reference intakes. Now, what he's basically referring to is that there are diseases that are affecting the efficacy, how well a vitamin is going to bind, as an example. And if it can't bind properly, you need more of a dose. So simply put, it's at higher doses of some nutrients are needed for some people based on their genes. So these are what are called SNPs, and we'll talk a little bit more about them as we go through tonight's class, but it stands for single nucleotide polymorphism. And what that basically means, and I won't really refer to it much anymore, it is just a variation in your gene that makes it such that something may be less effective, which would therefore require you to need more of a dose of a certain vitamin, let's say. And this field is called nutrigenomics. And there are many companies now that will allow you to run your genes and come up with looking at the most common SNPs, these single nucleotide polymorphisms, to be able to determine perhaps for you whether you need to avoid something, whether you need to take more of a vitamin for something, whether you need to be cautious with a toxin. We'll go through all those. And I run these for some of my patients who ask for it. And ultimately, I don't think it's going to make these dramatically huge differences in terms of disease rates. But what it does is it gives you an idea of things to be on the lookout for, and to optimize your diet in a way that is tailored to your genes. So what's the history of biochemical individuality? Which basically just means, of course, how are you on a biochemical basis unique? Well, it really started right with Mendelian genetics. Gregor Mendel, we all learned about, he was a monk, and he was crossing peas and was able to sort of determine certain traits of these peas based on different inheritance patterns. And that was sort of the first set of studies, at least in modern medicine, that basically showed that there is a uniqueness about our expression, about how we look, about not just our external traits, but our internal traits as well. And in the 50s, there was a doctor by the name of Roger Williams, and he coined the term biochemical individuality. And he observed that even twins are very different based on differing environments. And just last week, I read a report that the microbiome, we all have this, we've spoken about it so many times, this unique microbial environment inside of our gut. And believe it or not, twins even have very, very different microbiomes, significantly so. Only like 30% match between twins. And we've learned in many prior classes that when you have this significant difference, ultimately that is going to mean that there are a whole host of other things that are going to be unique as well. And he termed this one notion genotrophic disease. This is where your genetic uniqueness creates a demand for specific nutrients beyond the average intake. And that this is sounding very similar to these SNPs. Of course, this is before the time that that this sort of came about. The next stage came with the Human Genome Project. And everyone was very excited when the human genome was coded, because we thought that since we thought that everything was genetic, and therefore once we decoded the genome, that we would solve problems. And of course, some problems were solved, but more questions were raised than answered. And we started to understand that there is so much variety, as well as external things happening that allow for the expression or prevent the expression of certain things. So your genes are very highly modified by the environment. And then, of course, we have these SNPs as well. So this adds another layer of complexity to human health. Now, we've spoken about these SNPs, single nucleotide polymorphisms, as an example of protein. Proteins in your body do a whole host of things. And when a protein is formed, it's a very complex structure with lots of bends and turns and shapes and that sort of thing. And unfortunately, if there is a SNP, it might not be folded properly. It might have a kink in one area that it's not supposed to. And as an example, that could prevent it from excreting a toxin, like someone else. Or perhaps you need an excess amount of a certain nutrient because it can't bind or maintain activity. These are some of the examples of what happens with proteins. But ultimately, there are other things that are going on as well. When it comes to adverse drug reactions, we all have variations in drug metabolism and how our bodies process medications. And the head of GlaxoSmithKline said the vast majority of drugs, more than 90%, only work in 30 to 50% of the people. Well, why is that? If we were all completely the same, that wouldn't be the case. And so even when it comes to pharmacology, the drug companies understand the wide variety of differences. And when you start to understand these differences, it really makes you realize that we have so much work that needs to be done to understand the human body. And that's not going to take place by finding a silver bullet medication. It's going to take place by understanding the unique biochemical individuality of each person. As an example, codeine doesn't help pain in 10% of people because there's a SNP that results in a less active protein. Codeine has to be converted into morphine in the body. And if it needs a certain protein, a certain enzyme to be able to go to that next step. And if you don't have that, you're not able, codeine is not going to help with pain. Another example is this TMPT gene, which we sometimes check as doctors, because if you have a mutation in this gene, there's a certain medication that can actually become lethal at the normal dose if you're in the 10 to 15% of people. And what I would like to say is these are just two examples. There are other medications that have been proposed and have actually been studied, that one of them being one of the antidepressants. The point I'm hoping is starting to become obvious is that at some point in time in the future, we're going to be studying these SNPs to be able to determine the efficacy and potential toxicity of some of the medications that were given, because we can look at some of the changes that are happening when it comes to someone. If you have a mutation in a certain gene, that ultimately is going to lead to a situation that perhaps could lead you to more of a side effect. And this has led to a new field called pharmacogenetics, which is the study of how genes affect a person's response to drugs. So this combines drugs and genomics, the study of genes, to develop effective, safe medications and doses that will be tailored to a person's genetic makeup. Ultimately, that's what's going to happen. And unfortunately, there are some genes that have already been identified, but unfortunately, modern medicine progresses somewhat slowly, and it's going to take a decent amount of time, unfortunately, for this to filter down into the clinics. But ultimately, in one study said, in the future, whole genome single nucleotide polymorphism, SNPs, profiling might allow an unbiased method of determining genetic factors to adverse drug reactions, but might be limited by the lack of adequate numbers of patient samples. In other words, they're saying basically in the future, we'll probably be checking these more and probably fairly extensively, but right now it's early on. And hopefully, you're getting an understanding of why ultimately, there are certain medicines that just aren't going to work for people, and some that are going to be more dangerous than others. Also, we spoke about how these enzymes can be different and have different abilities. So some people have better detoxification enzymes. People who, example, is smoking. Not everyone who smokes is getting cancer. 10 to 15% have, unfortunately, problems with a certain gene called the GST genes, which are associated with detoxification. And if you have that, you're at a much increased risk for getting cancer with smoking because your body is not capable of making the same sort of detoxification as someone else. Now, when it comes to nutrition, getting a little bit of a delay here. When it comes to nutrition, there is the same sort of situation. There is the situation where there are certain genes that are going to lead to you needing more of a certain medication. And therefore, when you do nutrigenomic analysis, you can come up with genes that require you to take a little bit more vitamin C, other genes that will lead you to more of a risk for weight loss with certain things like saturated fats, others where you need to make sure that you eat more vegetables that have folate in them, as well as even there's a gene that will predispose you to diabetes based on an enzyme that's going to cause you to have a certain blood sugar elevation. I'm getting, just going to exit here. 1 second. Okay. Sorry, everything has stalled. Hopefully you can still hear me. If you can't, let me know. Additionally, there are effects of early life and even prior generations. So we're learning that even pre-birth, the conditions of the fetus can affect nutrition and other things in health even before you're born. And even prior generations, believe it or not, you can carry on through the generation something that happened way before. The example, of course, I've mentioned before is that when Denmark was in World War II, they unfortunately went through a really bad period of being starved, basically. And the results of that actually have carried out to 2 generations with a certain predispositions to adverse health outcomes based on just 1 generation going through a very severe period of malnutrition. And then, of course, there are epigenetic factors. We've spoken about that before, where the environment influences the ability of your genes to express themselves in certain ways. So all of these things come together in all these different ways to create a situation where you are uniquely you. And now there are many different technologies, believe it or not, that allow you to be able to learn some of these things. So the first one is, and I know my screen is frozen, but that's okay. I'm not sure why the computer has frozen the way it has, but hopefully you're able to still see me, hear me. So there are technologies out there now that Sorry about that. I'm back. Apologize. I switched to a different computer. The other one froze. Give me one moment. Apologize for that. Technical difficulties. So we were getting into some of the current offerings that can allow you to get a little bit of a better understanding of your individuality. So the first is nutrigenomics, and nutrigenomics we spoke about is basically those single nucleotide polymorphisms that you can get a report, and then I go through the report, or a doctor goes through the report to be able to determine what you may need more of. I'm not sure where I cut off, but there are genes that make you need more vitamin C, and genes that will lead you to more weight gain with saturated fats, and genes that can affect risk factors with things like caffeine and grains, high risk for diabetes, as well as errors in detoxification, which would, in that case, would make it so that you should be eating different types of foods that will upregulate those particular genes. So a whole host of things, and those reports, as I said earlier, are not going to lead to any major, reversals of disease, but allow you to just understand yourself a little bit better and what might make sense in terms of changing your diet and that sort of thing. Continuous glucose monitors are also available now. There's been controversy on that, but ultimately what is amazing about that is that you can put this on the back of your arm and it measures your blood glucose, and you can determine what foods are raising your blood sugar too high, which is going to lead to risk factors. Oftentimes you would be amazed to think that there are certain things that you don't think would raise your blood sugar, but actually might. It could be that potatoes don't do anything to your blood sugar, believe it or not. There are situations like that, ultimately probably related to things happening in the microbiome. But ultimately, it'd be nice to know that if you think there's a food, maybe it's something else that's making your blood sugar rise too much. So anything that spikes your blood sugar is going to have negative effects if you're getting that all the time. And if your blood sugar spikes, the thing is that your blood sugar might be normal when you get your blood tested, but your insulin level, which most doctors don't get, slowly starts to increase from all these sort of spikes. If the spike comes up, it comes down quickly. That's not necessarily going to be reflected too much on your blood sugar labs, but your insulin level, again, which isn't checked over time, that's slowly going to increase, and that increases quicker. You sometimes don't see blood sugar elevations for sometimes years, but that insulin levels, the fasting insulin level, can go up. So if you can get a general idea of what's going on with your blood sugar, with foods, that makes your individuality something that you can read. Next is computational biology. We spoke about this last week a little bit, about how there's a company called Viome. There's several companies. One's called Viome, where they can take a stool sample and they can predict what is going to happen with a whole host of things, from risks for depression, as well as speaking of blood sugar, it can give you, based on all the data that they have collected, can give you an idea of the foods that might be something that you might have trouble with. I always say getting more in touch with your body is something that's going to be important to understand your individuality. And unfortunately, a lot of us are not in touch with our body. And what I mean by that is that there are certain things that prevent us from getting in touch with our body. The first, of course, is you being under a great deal of stress. When your body is constantly in flight or fight mode, unfortunately, you're not able to feel some of the subtler sensations that are going on in your body. And your body is always talking to you and telling you what's wrong with it. But ultimately, if we're chronically in a stressed state, not getting that much sleep, then unfortunately, there's going to be a situation where you're going to lose touch with those subtle sensations going on in your body. Additionally, we also lose sensory appreciation as well. If we're not exercising and stretching, we lose positional awareness in our bodies, and we start to get hunched over. There's so many things that go wrong as we get older. Artificial sweeteners and too much salt affect our ability to appreciate the natural flavors of foods, the natural saltiness, the natural sweetness. All these things interfere. They put a filter between us and get a better appreciation for our body. And then finally is advanced labs. There are lots of new advanced labs that are out there. I'm not suggesting that you get those ordered. What I am suggesting is just that that you know what they are, and also not necessarily relying on your doctors to order your labs. I know that might sound like a controversial statement, but if you go back to one of my lectures, all these are up on YouTube, and you look at the 7 blood tests that everyone should know about themselves, not all those, several of them are not going to be ordered by your doctor. Of course, I just spoke to you about one of them, insulin level, which this insulin level, again, goes up sooner than some of your fasting blood sugar, and therefore you can see earlier on if there's something that is going on. So all these things are available, and ultimately, I guess my goal for tonight's talk was for you to realize all the various things that make you unique, and to not really necessarily fall in line with everything that is, to not necessarily think of a diagnosis as this rigid entity, that there are lots of different inputs that make you incredibly unique, and to give you some appreciation for that and where modern medicine is going. So this is sort of a quicker class. Apologize for the technical difficulties, but I hope that gives you a better general appreciation for the uniqueness of the human body and the uniqueness of you as well. So look forward to seeing you next week at Wednesday Night Live at 8 p.m. And I wish everyone, I hope everyone stays well.